Hello, and welcome to today's Let's Talk Health event. Life-saving technology, how pacemakers and defibrillators protect your heart. I'm Dr. Steve Righteous, Senior, President and CEO of NKC Health. Thank you for joining us. Today, we'll explore how the heart's electrical system regulates its rhythms and what happens when those cardiac impulses stop working properly. We'll also look at new technology and how it's helping patients with abnormal heart rhythms feel better and live fuller lives. Our speaker today is Dr. Ethan Hacker from NKC Health Heart Care. Dr. Hacker is board certified by the American Board of Internal Medicine. He earned his medical degree and completed his residency at the University of Kansas School of Medicine. Dr. Hacker finished his training with a fellowship at the University of Oklahoma College of Medicine. After our presentation, Dr. Hacker will answer questions you've submitted using the Q&A feature while registering. And now, please join me in welcoming Dr. Hacker.
Thanks, Dr. Righteous. It's a pleasure to be here. I find it always helpful to start from a normal perspective of what the heart's doing and its normal conduction system. So we'll go through just a little bit of that first, and then we'll talk about how these devices can help your heart function. Normally, each heartbeat is started off with the sinoatrial node. It normally beats at about 60 to 100 beats per minute, and that's usually what most people feel comfortable with. When that sinoatrial node fires, a couple of things happen. We start seeing that electrical waves spread through the atrium, and then it encounters something called the atrioventricular node. That's a place where it pauses before it proceeds on to the bottom chambers of the heart. And these bundles called Purkinje fibers and bundle branches, that's the heart's normal biological wiring system. And then it spreads down into the ventricles, giving a nice organized contraction. This helps the blood flow efficiently through the heart and out to your body, giving us that normal lub-dub that we're all used to hearing from the heart. Just like anything else in the body, though, that wiring can go wrong and cause various different problems. We typically categorize these two problems into bradycardias and tachycardias. Now, those are big, fancy doctory ways of saying that the heart can either beat too slowly in bradycardia or beating too fast in tachycardia. Bradycardia usually leaves you feeling tired, fatigued, even fainting at times. Tachycardia, on the other hand, typically results in this feeling of a fluttering sensation, palpitations. You can even become dizzy or even pass out. Some of these fast heart rhythms can even be life-threatening. First, let's talk about bradycardias. So bradycardias can happen for a variety of different reasons, and most of the time patients are always first to ask, well, doc, why is this happening to me? And that can happen due to aging. Just like every other part of our body, the wiring in the heart ages, and sometimes it starts to fail. There are patients who have congenital conditions or conditions from when they were born that affect the heart's ability to conduct in a normal fashion, and that will result in the heart beating too slowly as well. There can be infection problems, there can be medications that can cause the slow heart rate to happen, and various other illnesses. So it's important that you have a conversation with your doctor about whether one of these illnesses may be affecting you, and if there's anything reversible that we can do to treat that bradycardia. Oftentimes, though, that there's nothing that we can identify that's reversible, or even if we can reverse some of it, you still have the problem with a slow heart rate, which is where the first cardiac device that we're going to talk about comes into play, and that's a transvenous pacemaker. This is a small device that gets implanted. The actual brains and battery of the device sit outside of the chest wall with wires that go down through the blood vessels and into the heart in order to stimulate the heart to beat faster. These devices use electrical energy to both sense what's going on in the heart and respond appropriately to increase your heart rate. The second problem, tachycardia. Same question, why does this happen, doc? Why am I having these palpitations? Why am I having this fast heart rate problem? There's a variety of different reasons for that too. Sometimes it's related to scar tissues from prior heart attacks. There can be abnormal electrical connections in the heart that can lead to these tachycardias, or inherited conditions that affect how the heart is able to signal and depolarize with each heartbeat. Oftentimes, medications can be used to treat these fast heart rhythms. We can also use something called catheter ablation to treat these, where we go in with small tubes into the heart, study the heart to see why it's conducting inappropriately, and potentially even ablate the problem. And then in some circumstances, these heart rhythms pose a danger to people's lives. And that's when we start talking about an implantable cardioverter defibrillator, or an ICD. They work a lot like a pacemaker. They're capable of performing all the functions of a pacemaker, but they have the additional large capacitor and battery such that the device can charge up and shock the heart and depolarize the whole heart at the same time, allowing it to reset back into a normal rhythm. The next question that patients often ask is, how do these devices work? And they do three functions. They listen to what's going on with the heart currently, they analyze those signals that it's getting from the heart, and then they react to that. They either deliver stimulus to increase the heart rate, or they deliver that shock to reset the heart back into a normal rhythm. Next question is, how are they usually put in? So we always talk with our patients beforehand and make sure that this is the right treatment choice for each of our patients. The surgeries are generally a very small, minimally invasive surgery. It's a 1 to 2 inch cut that's placed up in the upper chest. And we dig down underneath the fatty tissues, just above the muscular tissue there, and place the brains and the battery of the device in that location. The wires are then placed into the blood vessel using a needle, down and into the heart, where they're secured using tiny little corkscrews that dig into the heart muscle themselves to hold the leads in place. Most patients can go home the same day or maybe the next morning, just depending on how the procedure goes. Next common question is, does it hurt when that happens? And I always say that, the most painful part of all of these procedures is the numbing shots that we put in to numb the area that we're going to be working in. We also usually give medications through the IV for any additional pain that's happening or anxiety that the patient experiences, ensuring a nice, relaxing, comfortable procedure. The next big thing that I always talk about is problems that can occur from implantation of these devices. Bruising, swelling, or bleeding is always a possibility whenever we're having a procedure. Damage to the blood vessels or the heart itself can be a potentially dangerous consequence of the procedure, but fortunately is quite rare. We also talk about living with a defibrillator. The chance that you get shocked and have an event like that is always something that can cause anxiety or depression or concerns that way. But, we can very easily treat that and give a good discussion about that ahead of time so that patients are aware and even treat it with medications if necessary. And then the last thing we always have to talk about is infections. Infections are very uncommon and rare occurrence, but it can be quite serious if that does occur. The wires that the pacemakers and defibrillators are composed of are designed for durability. They're going to be in your heart for the rest of your life, beating 60 times a second or 60 times a minute, every minute of every day for the rest of your life. And they have to be very durable because of that. But part of the problem then is those materials that they're made of allow infection to be led down and into the heart. So if those devices ever do become infected, the whole device does have to be removed. Because of that, we've started developing newer technologies in pacing and defibrillator technologies that try to avoid having the wires placed in the blood vessels. This particular technology shown on the screen here is a Micra leadless pacemaker. It's the smallest pacemaker. It's about the size of a vitamin capsule, and it's implanted directly in the ventricle. The infection rate of these devices is magnitudes order smaller than the traditional lead-based technologies. This is a dual-chamber pacemaker, so it can pace both the bottom and top chambers with individual devices, again, without any sort of leads within the blood vessels. And one of the newest technologies to hit the fields is the extravascular ICDs. These are ICDs that are placed on the outside of the thoracic cavity that can defibrillate the heart and sense the heart without ever having to put a wire in the blood vessels. So with that, I'll turn it back over to you, Dr. Righteous, for some questions.
I just have to tell you that this technology is stunning.
Yeah.
I did not know literally until last week that there were pacemakers that did not have leads. And I didn't know until the past few days that there were pacemakers that could have leads on the outside of the heart. It's just shocking to me.
Yeah, it's fascinating.
It's fascinating.
And it's rapidly evolving.
So we have some questions here from the audience.
Mm-hmm.
The first question is, if someone has a defibrillator and a history of spontaneous coronary artery dissection, can they safely use a monitor for congestive heart failure? And if so, how often has it been used safely and with good results? Now, this is a fairly specific question. So How do you deal with defibrillation, spontaneous coronary artery dissection, and congestive heart failure?
Sure. So defibrillators in and of themselves are actually quite a useful tool for monitoring heart failure. They actually have a built-in heart failure monitoring technology that measures the fluid volumes in the chest and can actually predict someone is going into a heart failure exacerbation before they even are aware of the symptoms. So they in and of themselves are a form of monitor for heart failure. I think the question, to some degree depends on what kind of monitor we're talking about. There are monitors that can be placed within the lungs themselves that will tell us a lot of information about the patient's fluid status and whether they need to get some fluid off or get more fluid on. And those should function seamlessly with defibrillators in place. So I would say overall, the answer would be yes, and it should be used with great results.
It's just such a technological advancement. So what are some of the myths that people have about pacemakers and defibrillators?
The most common ones are things like, can I still use a microwave? Or can I go and, do some activity that I used to do? They used to say, don't use microwaves, don't be careful what tools you use and those kinds of things. The modern devices are very good about rejecting electromagnetic interference, or EMI is what we call that. The only things that we really say are exception are very high voltage things like arc welders, or if you're working around high voltage equipment, those are generally things that we would say you got to use caution with. But, the myth of you can't microwave food anymore is totally debunked now.
So this is coming from me, when you go to a ball game or when you go to the airport, you have to go through metal detectors.
Right.
Do the defibrillators and pacemakers set off the metal detectors?
Yes, most of them will still alert the security to the presence of metal. But we always make sure that patients have an ID card that's filled out for them that they get along with their device, such that the security guards and all of them are very familiar with implanted devices, and that card is kind of your pass through that.
Good.
So,
Good. Thanks.
Yeah.
Okay, next question. How do these devices actually sense the heart rhythm? You've shown pictures where there's wires on the inside of the heart, on the outside of the heart, or those little kind of vitamin capsule devices. But how do they sense the heart rhythm?
Well, so without getting too terribly nerdy about it, the wires themselves have two different metal contacts on them. And when that heart's depolarization, the beat of that heart flows past those contacts, it senses that electrical current passing it. It then goes back up to the device. The device's computer interprets that signal, processes that signal, and then, according to its programming, determines what it should do next based on that signal.
And you're telling me that it does it 60 to 90 times a minute?
Every beat.
Every minute of a person's life?
Yep.
Wow.
Well, and even faster if they're in one of those tachycardias. So it's quite fast. Yeah.
That's impressive. How soon do patients usually feel better after getting a defibrillator or a pacemaker?
Part of that depends on the reason that it was put in. For patients with pacemakers, pretty remarkably, almost immediately, that when they start pacing, they immediately feel more energy and feel a lot better. Defibrillators, on the other hand, are usually put in prophylactically at this point. We call it primary prevention. And those patients don't usually notice a difference in how they feel unless it's a specific kind of defibrillator called a CRT-D. That's a device that's designed to resynchronize the heart's beat, and a lot of those patients also feel better quite rapidly after it's implanted.
Impressive. So what's the most surprising things that people tell you after they get a device?
I think the most surprising thing to most people is how normal their lives are. A lot of people get in their own heads and think, oh, this is going to be horrible. I'm going to have a device put in, and I'm going to be part machine now. And most people forget that they have them the vast majority of the time, with the exception of the occasional device check, or 10, 15 years down the line, they have to have a battery changed. But outside of that, it's a normal life.
So they get back to their normal level of activity, unless you're a welder or something like that.
Right. Yeah.
But they feel more energy, they get back to their activities, or just
as soon as that incision is healed, they're back to their normal selves vast majority of the time.
That's great. Yeah. So how often, after you put the pacemaker or the defibrillator in, how often as a cardiologist do you have to check on the device?
So we typically check on the device about a week after it's put in. We'll do a check on the device, and we'll actually inspect the wound and make sure that the wound is healing appropriately. And then after that, it's usually every about 3 months we'll get a remote check, or we'll have the patient come into the clinic and we'll check the device that way.
So a remote check, they're at home, you're in the office, and you can...
Yep, it's one of those modern marvels. We can either get a bedside device interrogator, or they can sometimes even do it through their phones, and it'll forward that information off to Medtronic servers, and then they forward it on to us.
So that term, that verb that you use, interrogator, I know that I've heard that throughout the years. So can you just slow talk what an interrogation is, a pacemaker or a defibrillator?
Yes, we're not putting bright lights on you and playing good cop, bad cop, or anything like that. All that means is that we're establishing a connection with the device, giving the device information and taking information off the device.
Okay.
That's all it is. All the devices have their own proprietary methods of communication just to protect the patients, obviously, from any sort of interference. But we use they call them the interrogators, but those are the specific devices that can communicate with.
You're not being mean to the device.
No.
Just asking if you
No.
Okay. How have leadless pacemakers changed the way we treat patients with slow rhythms?
I think the biggest way that is starting to change things is particularly related to infections, kind of like we touched on earlier. It used to be a lot of the central dogmas is if a patient gets a bloodstream infection with one of these devices put in, depending on the kind of bacteria that grows, that device absolutely has to be taken out. But with these leadless technologies, that's not the case. And in fact, the vast majority of the times, the device can remain in place and the bloodstream infection can be treated with antibiotics alone, as opposed to having to undergo a surgery. Removing a brand new lead is not such a big deal, but these leads scar into place over long periods of time, and getting them back out of the heart can be quite difficult, and occasionally requires advanced tools like lasers and blades that actually cut the lead away from the blood vessel it's in. That can be quite dangerous. So not having to do that as often is a major plus for patients.
And this also is just part of my new learnings over the last week, that whether it's the leadless pacemaker or the ones that you put underneath the skin here, they'll have batteries.
Yeah.
And sometimes, just like at home, batteries wear out.
Yeah.
How long do the batteries typically last in some of these pacemakers and defibrillators?
Yeah, that's a great question. So some of them, it depends on how much you have to use the device. Some of the devices, if they're getting used all the time, if the defibrillator has had to unfortunately shock you out of those dangerous heart rhythms multiple times, that depletes the battery quite quickly. But in general, I quote 10 to 15 years for most patients.
Wow.
So it can last you a decade or longer with good programming and load need for the device.
That's great.
Yeah.
Okay. So what kind of patients benefit most from the extravascular ICD?
Yeah. So for longest time, the dogma was that the transvenous systems are the default and these are for exceptional cases. But I think that's being challenged a lot because of this whole infection concern and the rates of lead fracture or broken wires on the devices. We've started to gravitate a little bit more towards offering that as a viable option for most patients. The one caveat that we have for that is those devices, those particularly the extravascular ICDs, don't pace the heart very well. They can shock the heart perfectly fine, but they don't pace the heart well. So if a patient is thought to need pacing in their near future, or if they actively need pacing, it's not a good device for them. But just about anybody else can be considered for one.
Great. Yeah. So how does remote monitoring work, and how is it useful?
Remote monitoring, I think we touched a little bit on it earlier, is where we don't have to physically come in and see us. You have a device that interrogates the pacemaker or the defibrillator remotely and sends that information to us. And it's wonderfully useful because if the device ever has an issue, it can remotely send transmissions to us so that we can look at it without ever having to bring the patient into the clinic. Patients that live 2-3 hours away from us, we can still keep tabs on them and make sure their device is healthy even from a long ways away.
this has nothing to do with pacemakers or defibrillators, but back when I was practicing, every once in a while, there would be a patient that had a funny rhythm while they're in the hospital. Mm-hmm. And they would put a device on them for 30 days.
Right.
And monitor their heart rate for 30 days. What's that device called, and how is that different than a pacemaker?
Yeah, so we call those monitors or event monitors or looping recorders. You might hear any one of those different terms. Those devices are great for monitoring the heart's rhythm. They do similar things to the pacemaker in terms of listening to what's going on with the heart. They have small computers in them that can help to interpret what those signals are and relay that information to us. The only thing they can't do is they can't stimulate the heart, so they can't provide any treatment for the heart.
So they're like a tape recorder of your heart rhythm.
Yeah.
And do you have to come in, or can they monitor that heart rhythm remotely?
Some of the devices are capable of monitoring it remotely, but most of them will have to be either mailed back into us or given back to us here before interpretation afterwards. One of the newer technologies that we also use is something called an implantable looping recorder, or an ILR, if you've heard that term. That's a tiny device, about half the width of my pinky, that gets inserted just under the skin over the top of the heart, and that can monitor for heart rhythms over a much longer period of time. The batteries on those devices will last 3 or 4 years.
Wow.
So,
well, it's just very impressive.
Yeah.
So I marvel at the technological advances that cardiology brings to their patients, and I marvel at the technological advances that we're able to provide to the patients that you all treat.
Yeah.
So thank you, Dr. Hacker. We hope today's presentation was both informative and helpful. I know for me it was. NKC Health looks forward to bringing you more insightful and engaging Let's Talk Health presentations very soon. To learn about new Let's Talk Health events, visit nkchealth.org/subscribe and sign up for our monthly e-news email. Once again, thank you for joining us. Have a good afternoon.